having healthy, productive people and also having a resilient organization from a business perspective are not opposing values, right? You can do both. And having an effective well-being strategy actually supports both of those objectives. So what does that mean? It means providing programming, providing a workplace culture that allows people to be their best selves, to find that balance across whatever well-being means to them, but also the realization that if we can do that individual personal well-being aspect right, if we get it right, then we will reap the reward on some of the metrics and the KPIs that matter for the organization around engagement, employee turnover, employee satisfaction, injury at work, accidents, and some of the other, more business-oriented type metrics.
Hello, and welcome to the Mental Health Advantage podcast, where HR, benefits, and total rewards leaders explore the future of workplace well-being. I'm your host, Stephen Sokoler, founder and CEO of Journey, the leading proactive mental health solution for modern companies. Today, I am joined by Abinue Fortingo, a well-being and population health strategist who has helped organizations across industries and continents build sustainable, people-first solutions that actually move the needle. How you doing, Abinue?
I am doing great, Stephen. How are you?
I'm good. It's Friday afternoon. It's 2:00. Sun is shining. Life is good. Life is good.
Absolutely. Thanks for having me on. Looking forward
It's
to it.
my pleasure. It's my pleasure. We always have great conversations off the record, and so now I'm excited to have one that we'll share with other people. So, so everybody knows, your work touches a lot of things, right? From benefit redesign to virtual care to global strategy, and I've always found you to be one of the most thoughtful people in the space. No pressure now. Why don't you tell us a little bit about your background? How'd you end up doing what you're doing right now?
So I've been in the population health and well-being consulting space now for about 15 years. My academic background is in public health. Got my master's in public health degree, MPH. And my first sort of professional job was in benefits consulting. And after doing core benefits consulting for a couple of years, I essentially decided to pick a path to focus on working with leading organizations to improve the health of their workforce, right? This is how a significant number of us make a living, right? We wake up in the morning and we either physically go to work or we log into a computer and start working. And so employers have a huge stake in making sure that the folks who show up for them are presenting as their best selves, right? So it's invigorating to be a population health and well-being consultant. No 2 days are the same. No two clients are the same. And quite frankly, I couldn't see myself doing anything else. So I currently lead population health and well-being consulting for our large market clients as part of our team here at Brown & Brown. Prior to that, I was at another global consulting firm.
Fantastic. So you've worked with many types of companies, right? Fortune 500, global NGOs, fast-growing enterprises. What's one insight you've gained from seeing well-being through so many different lenses and over such a long period of time?
I find that organizations are in different phases of their well-being sort of journeys, right, Stephen? But the constant aspect that I find is most organizations genuinely care about having an impact and making sure that their employees show up, in their best selves and are productive and are healthy and find balance in their own personal well-being, right? So there's an element there of genuine caring about employee well-being. Organizations are in different phases. You have organizations that are such as that are in the what we call the wellness 1.0 phase, where the program is not very mature. There's a lack of a strategic component. Maybe they have some individual disjointed programs that are supporting health and well-being. Maybe there's a steps challenge somewhere, platform, maybe there are biometric screenings, but not a strategy, right? And there's that lack of connection to broader benefits, the broader benefits plan or approach. And then there are those organizations that are in what I would call the well-being 2.0 phase. Based on some surveys that we've done at Brown & Brown, I would say a majority of larger organizations are in the well-being 2.0 phase, which is there's an acknowledgement that well-being is a very important component of broader workforce strategy. There is also the clear sort of definition of well-being pillars that they want their people to be supported by. So physical, emotional, financial, social. So those are typically called out in communications and programming. And I would say the third component of Wellbeing 2.0 is we tend to see a much tighter connection to benefit strategy as well, because those two things sort of go hand in hand, right? And then the employers that are in the third phase of this spectrum are what we call the Wellbeing 3.0 people. And this really is where I think a lot of leading organizations are going to go over the next, 2 to 3 years, which is this acknowledgement, this realization that having healthy, productive people and also having a resilient organization from a business perspective are not opposing values, right? You can do both. And having an effective well being strategy actually supports both of those objectives. So, what does that mean? It means providing programming, providing a workplace culture that allows people to be their best selves, right? To find that balance across whatever well being means to them, but also the realization that if we can do that individual personal well-being aspect right, if we get it right, then we will reap the reward on some of the metrics and the KPIs that matter for the organization around engagement, employee turnover, employee satisfaction, injury at work, accidents, and some of the other, more business-oriented type metrics.
Yeah, I love that you ended there because that's one of the conversations that I have pretty much all day, every day, where I talk to really thoughtful HR leaders who understand the importance of prioritizing mental health, both from a benefit standpoint and from a culture standpoint. And then they might have to sell something up to their CFO and they have to convert it into the terms that actually matter, right? We're not doing this because it's a nice thing to do, although that is a good reason in and of itself. We're doing it because it's going to actually generate real business outcomes. When I was researching for this conversation, I came across a piece that you co authored called A Sustainable Employer Framework for Effective Global Health and Wellbeing Strategies. And I thought it was an awesome, clear, practical model, especially for companies that are moving from we have good intentions to we have a real plan.
Right.
And can you walk us through the 5 steps in that framework: discover, analyze, design, deploy, and measure?
First of all, Stephen, thanks for actually reading the articles that we put out, that I put out. So I appreciate that. Um, but I think, we came up with this framework to help employers, organizations think about how they can have more effective global health and well-being programs, right? And you talked about the 5 components of it. The first one is discover. And this really focuses on the question around sort of what does well-being mean to the organization, right? What are you trying to solve for? What are you trying to address, right? And so for some organizations, it could be, well-being means we want our people to show up and be their best selves, right, at work. For other organizations, well-being could be we have these really broad and clearly defined sustainability goals, and we want to make sure that our well-being strategy supports those sustainability goals, right? For another organization, it could be we invest in so many of these programs and we want people to know that these programs are available so they can have better access to them and actually use them. So we spend a lot of time as consultants really trying to understand the why, right, for each organization, because I think that's informative. Then the next step is sort of the analyze phase. So this is where we look into empirical data around who your people are, demographics, where they live. We've built out tools that showcase sort of the realities of healthcare ecosystems and well-being support systems country by country. So we leverage those types of tools for our clients in the analyze phase, right? So health systems across the world differ. People are faced with different challenges when it comes to, preventive and infectious disease or even chronic disease. So that's important. We also, during the analyze phase, to the extent that we are able to do this, try to get a sense of the engagement profile or profiles of each workforce, right? And that means looking at aggregate data if that when that's available through some of the vendors. But it also means, again, wherever possible, having the opportunity to do employee pulse surveys, conducting focus groups potentially with some employers. And we gain some really valuable insights in the analyze phase that help us understand what are the top challenges, what are the top health and lifestyle related risks, but also what are sort of personal well-being preferences, right? So how do people want to be supported? That varies by country, that varies by generation, that varies by culture, right? So all of that stuff is really important. The design phase collects what we hear from organizational leaders around what they're trying to solve for from Discover. It takes the data that we've collected in the analyze phase, and then we provide clients with strategic, well thought out considerations around how they can deploy tactics, deploy policies, programs in the design phase to improve employee well-being. And then on the fourth phase, this is around deploy. This speaks to implementation. How do you implement this in a way that makes sense? So typically, we recommend some really careful, well thought out processes to engage local stakeholders such as HRBPs, right? They're local or the local benefit stakeholders. This is also where we look at the deployment of potentially well-being champions networks globally or leveraging existing networks. This is also where we tap into, the support from employee resource groups locally. And a key component of the deploy phase is obviously the communications aspect of this, right? So how do you communicate your well-being strategy, your well-being resources, your well-being programs and benefits in a way that is effective, multi-channelly effective, but also leveraging local languages, translation, but also being aware, right, of local customs. Let me do a take two on that real quick, Stephen. But also the communications aspect of this is very important, right? So how do you deploy communications effectively globally, leveraging multiple channels of communication, making sure that those communications are available in the appropriate languages from a translation perspective, but also ensuring that it's culturally relevant, right? So that's important from a deploy phase. And then lastly, on measurement, you can't improve or you can't address what you don't measure, right? So the measurement phase sort of speaks to itself. And I would say that the measurement phase doesn't signal the end of it. It's quite frankly a continuous loop, right, that we deploy just to ensure that we're actually hitting some of the targets that we set for ourselves in the design phase.
Got it. And where do you see organizations typically get stuck or skip ahead? And kind of what's your advice for making this framework actually come to life in the real world across companies at different geographies and company sizes and industries?
You're asking for the secret sauce, Stephen.
Exactly. Exactly.
So I think there are a couple of things that, in my opinion, determine success here. The first thing that I tend to see consistent with many organizations that are, I think, doing an effective job at global well-being is leadership support. That is a foundational, critical element, right? And that means having visible, vocal leadership that understands the value of effective global well-being programs, but also champions, right? The initiatives that need to be rolled out. So that's sort of thing one. Thing two is governance. So governance is fancy word, but to break it down, it basically means who owns it, right? Who's responsible? Who needs to be informed? Who's a stakeholder, right? Another element of governance, quite frankly, is who's going to do it. So a lot of times, the role of local, HRBPs, HR business partners comes into play. The role of a well-being steering committee in the organization, benefits leaders, regional benefits leaders, but also well-being ambassadors, right, comes into play in terms of who's going to do it. And the third aspect of governance that I think is also really important is the financial side of it. So, Stephen, many times you've got to have budget, right? This needs to be in someone's budget in terms of everything that the organization wants to invest in from a global well-being standpoint. So, having a carefully and clearly articulated governance strategy around leadership support, who the stakeholders are, but also who owns the budget and who's doing it, I think is critical for real success.
Okay, let's talk about well-being across the maturity curve. So, what are the biggest differences you see in how a global enterprise versus, say, 1,000-person company should approach well-being strategy?
So I'll tell you that for many multinational organizations with, let's just say, more than 10,000, more than 5,000 employees, the conversation around well-being is something that is seen more as a business imperative rather than something that we need to just do right to make people feel good. But to be very clear, that perspective is also shared by many smaller size employers. And that I think is the right perspective around us, which is well-being is not having a wellness program, but well-being is really having a more comprehensive, integrated, interconnected strategy or approach that connects, programming, resources, workplace culture, and delivers very clear messaging around how do we support our employees and measures the effectiveness of all of those programs, right? In terms of impact on also employee health, but also business outcomes. So we're seeing many multinational organizations take a more strategic approach, what I referenced to Stephen as well being 3.0. And I think that's been successful in many cases because these organizations can then look at metrics or KPIs that matter, like employee engagement, like employee safety. If they do employee pulse surveys looking at, employee sentiment around questions like company ABC cares about my health and well-being, organizations that have taken this strategic approach can look back at some of those numbers and validate, right, why they've taken a more strategic approach.
Gotcha. And how can a company evolve its approach over time without overhauling everything at once?
I think, taking a very pragmatic approach is important here. So, number one, most organizations are faced with very limited resources. Number two, I think there's within every organization sort of a competition for where do you invest the next dollar, right? So I think it's really important to, after you've looked at the results of the discovery phase and you've looked at the results of the analyze phase, to have a conversation around prioritization, right? So if your current state assessment of your global well-being approach identifies opportunities around, better access to preventive care or mental health support or caregiving or leadership effectiveness, you need to have a conversation and ask an organization around which one of these things do we want to tackle first, right? And this is where, Stephen, from my perspective, having a 2 to 3 year roadmap also comes in into play, and the roadmap really serves as our guide, right, to keep us honest, right, so that if we say we're going to tackle this issue in year 3, that we actually make sure that we go back and do it. So I would say after the current state assessment phase, to then have a conversation around how do we prioritize each of these components. And many times the prioritization of those components can be driven by broader business, factors, right, or external factors. So I'll give you an example. If an organization is going through M&A activity and there's a lot of anxiety, for example, about change management, right? Perhaps that may be the right moment to prioritize, leading with empathy and effective leadership, right? We're all in this together as part of your global well-being strategy. If an organization has workforces in places where there's political unrest, as an example, as we are aware of in parts of the world, perhaps that's an opportunity to prioritize duty of care, right, as an employer, to prioritize mental health support. So the priorities sort of shift based on external factors, but also based on the business climate as well.
Thanks for listening to the first half of the episode. I hope you're walking away with some valuable insights. I want to take a quick pause to tell you about my book, The Mental Health Advantage. If you found this conversation useful, you'll find 300 more pages packed with strategies, insights, and real-world applications. Grab your copy on Amazon. Just check the show notes for the link. And if you're looking for a more comprehensive mental health solution for your company, let's chat. You'll find another link in the show notes to reach out and explore how Journey can help you. Now back to the show. Let's go to the topic we touched on before, which is how do we connect this to business value?
Yeah.
So, how do you help leadership teams see well-being not as a perk, but as a business imperative?
So one of the first things I do, Stephen, when I start working with an organization is to, you know, before having even the conversation with the stakeholders, is to go on that organization's website, click on the About Us page, and just read what they say about themselves, right? And sometimes also read what they put out there as their sustainability report. Most organizations have, ESG reporting, sustainability reporting that they put on a regular basis. And I always find those reports and that section of the About Us page to be fascinating because it gives you a real insight into the values, right, of those organizations. So when I get a good sense of those values, so we care about the safety of the workplace and the safety of our people. We care about, inclusion, belonging, diversity in the workplace. We care about making sure that our associates and employees have opportunities to advance their careers, right? We care about the impact that we have on the environment. And oh, by the way, here's how profitable we've been as an organization over the past 5 years. So I take all of those metrics, then I have a conversation with the organizations around. There is a correlation between having, healthy, productive people and also impacting these metrics that you care about. And there are studies that have shown that, which are quite credible. So I think that's a really good and effective place to start because my role as a consultant is to make the case for well-being, that well-being will have an impact on individual sort of health risk and lifestyle risk and clinical risk. But quite frankly, also to make the case that an effective well-being program, effective global well-being approach should have an impact on the metrics that matter to the organization.
Hmm. And what metrics or outcomes do you recommend looking at, both from a health and a financial lens?
So most organizations have, as we've talked about, Stevens, robust point solution vendor or benefit ecosystems that support their employees. So that's usually a good place to start when looking at, some health KPIs. So engagement in these programs is a good place to start. Obviously, some of the availability of this data from a global perspective may be restricted, right? So engagement. I also want to look at self-reported changes in health risk. So, to the extent that there are health risk assessments available or other sort of assessments available, you want to see how people self-report, right? Their overall health and well-being indicators. You also want to look at some of the validated metrics to the extent that, again, that data is available. So in the US, that would be claims data, and other set of data, clinical outcomes data to validate the effectiveness of the programs. From a business standpoint, we look at, again, the correlative impact on business metrics like employee retention and turnover. You can also use cohort analysis to look at, for the people who are quote unquote engaged in the well-being program, do they also report higher levels of engagement, right, in the annual employee engagement survey? Like some of that research is fascinating when you actually do it by group by group. And to the extent that the answer is yes, right, and then that ends up being a good statistic, right, that you can sort of hold up as evidence of having an effective program. You could potentially look at safety, accident, and disability data again to see if there's any sort of correlative impact there. And then some of our clients have looked at productivity, right? So whether it's, hours billed or whether it's even revenue per employee by different segments of the business to then compare that to overall well-being indicators and say, are we seeing an impact there, right? So there are several ways that organizations can take their measurement approaches, looking at both the personal KPIs, but also and my recommendation would be always to look at the business impact as well.
Gotcha. And what's your take on ROI when it comes to mental health? And what should companies um, be measuring beyond just cost savings there?
And so I was hoping you wouldn't ask that question. I'm just joking. So here's what I would say, right, Stephen, is that you think about the baseline of our reality with access to mental health care. It's important for us to acknowledge a few truths, right? Number one, mental health remains underserved and inaccessible for many people in society today. As in, I think there's a lack of providers, and even when there are providers available, affordability is another barrier, right? So you kind of start there. A significant number of people with mental health conditions don't seek treatment, right? So there's also a sort of an underreporting effect there. So the reality is, if you're looking at a typical employer and you're looking at, for example, employee assistance program utilization, or you're looking at behavioral health utilization, I'm using more, and through the health plan report, I'm using a sort of US lens now. The reality is, whatever numbers you see are probably under representing, right, the true magnitude of need, right? And so when you ask me about the ROI of an effective mental health solution, or when my clients ask me about that, I usually try to paint this picture context about the fact that mental health remains underutilized today. So that's thing one. But also try to convey the fact that there's a cost to doing nothing when it comes to, not providing effective mental health support. And you see those costs show up in disability, right? So depression still remains the number one cause of disability globally. So there's a cost to doing nothing there. You see those costs in accidents and injury at work. You see some of those costs even manifest on the physical health side as well. So it's important, before like jump into the how do you measure ROI? What do you think of ROI? I think it's really important, Stephen, just to take the time to level set, right, on what we're dealing with. And so if you were to invest in an effective mental health solution, what are you going to see? I think, quite frankly, you're going to see your costs go up, right? Because you're going to get more people potentially using the solution. Sort of payment arrangement is on a per session basis or per case basis or even a per utilization basis. It's very likely that you pay a little bit more, right, for the newer effective solution. But what I try to do as a consultant is to clearly articulate the value of that investment, not the return, right? The value of that investment from here's how self-reported mental health risk is changing because of this new investment. Here's how validated mental health risk, right, is changing because, and we look at data from PHQ-9s and GAD-7s, sort of aggregated, and other sort of mental health measurement tools. And then we also look at disability leave data with mental health being the primary diagnosis and saying, are we making an impact on that? Where we have employee well-being surveys available, we've actually seen the numbers around my employer cares about my mental health move in the right direction after an employer invests in solutions. So I was never going to give you, Stephen, a 10-second response on this one. But I do think that laying out the facts about the challenges that we have with the mental health system, and it is improving, right, with the proliferation of virtual mental health solutions. I think laying out the facts, but also presenting the case why an increase in mental health utilization will drive increased costs, but that it's a broader conversation around the value and return. I think that's important for employers to understand.
Yeah, and I appreciate you giving a more complete answer because, to be honest, it's one of those things that comes up fairly often with clients and partners, and some are in the camp of, oh, all ROI is kind of bullshit, like everybody makes it up, and others are like, this is really important for us to make the business case, and we treat it really seriously.
Right.
But of course, sometimes it's hard to say this is the exact thing. Like we had a clinical study at Humana that showed that when employees had access to Journey, absenteeism was cut in half, right?
Mm-hmm.
So absenteeism was reduced by 51%.
Mm-hmm.
Now, how do I show that once we put it in place at XYZ company, absenteeism is not going to be cut in half because there's lots of other things, but those
Other
who
founders,
use
right?
it will show up to work more often because they have proactive tools, right? Or we had another clinical study that showed employers save almost $600 per engaged employee in healthcare costs, like in hard dollar savings. So you could say, okay, great. But then when you put it in the wild, who knows if this year healthcare costs are going to go up or going to go down based on all the macro trends, based on politics and world affairs and everything else. And so it's an interesting conversation that we navigate quite a lot. So I appreciate you
Absolutely.
sharing all that.
Yeah.
Let's talk about strategy here. How do you advise companies to create well-being strategies that are both globally consistent? Because what we hear from clients all the time is they want to harmonize their benefits globally
Right.
and also locally relevant.
Yeah. A couple of things. I think what's really important here is, as I work with organizations that have multinational workforces, is sort of the humility to know that I'm not the local expert, right, in that country, quite frankly. But to seek out sort of those local experts that are colleagues of mine, and to certainly bring their perspectives into these types of engagements, right? So I work with our global benefits consulting subject matter experts on our Brown and Brown team, number one, to get their input. Another thing that I think is really critical for success is to encourage my client contact, often US based, to also seek the input of their local and regional contacts in those countries, right, on what this global well-being strategy needs to mean for them. I think when you look at, again, going back to what we talked about a few minutes ago, employees in different parts of the world face very different realities about the maturity of the health systems, about disease prevalence, about morbidity, mortality, and sort of all of those drivers, and then also engagement profile. So having a good understanding of that is really important. I'll give you an example. I was For one client, we were having a conversation about on-site fitness. I think it was 30-minute conversation about on-site fitness, and we were like this close to get into a consensus about, yeah, most people already have like access to a fitness center network, or people have like some of these virtual fitness subscriptions, and maybe we should think about repurposing the spend. And someone from another country on that same call sort of raised their hands and went, actually in our country, that benefit perk is actually very valued because it's hot here. It's hot all the time. We're in the desert, and people do not want to. You're not going to like take a walk outside, right? You want to be indoors. You want to be in an AC, air conditioned environment, and just that simple perspective, I think, was very important, right? So it's important to sort of acknowledge, that you're not the cultural expert, and also to tap into the perspectives, right? Lean on the perspectives of employees and leaders locally. That you talked about globally consistent guiding principles with localized programs. I think that's very important. So again, for many organizations, they're very clear about what their organizational values are, right, Stephen? And I think you can build on a framework of globally consistent guiding principles based on your organizational values, right? So we care about supporting our employees to reach, their optimal definition of what well-being means to them by providing resources that are, competitive, that sort of thing. And what that looks like, though, from a delivery perspective, can be very different, right? Because you could have, for example, one EAP vendor in a couple of regions, another EAP vendor in another region, depending on which solution is more compelling and has the most robust network. So I think defining the what do we want to achieve in a globally consistent way, and what our values are, what do we care about when it comes to well-being strategy, I think that's really important. That's the global consistent guiding principles aspect of it, and then allowing for some flexibility around programming, right? So if the person in my example wants to have the on-site fitness centers in their location, they can totally have it. While if this other country wants to invest more on like healthy food, for example, or healthy food vouchers, they can totally have that, right? That's localized programming and customization from a programming perspective.
We talk a lot about the intersection of well-being, benefits, and total rewards.
Yeah.
Why is it important to break those silos?
I think what I have seen in my work consulting with other organizations is that the average employee doesn't compartmentalize that stuff, right? The average employee, they know what they make from a salary perspective. They have a very clear perspective on whether the benefits are good, bad, or ugly, or somewhere in the middle. And then they also have a really clear perspective on the workplace culture within that organization and whether or not they feel supported. So if you just think about it, Stephen, for everything that we've been talking about for the past 30 or so minutes, all of those questions in the average employee's mind fall under the umbrella of what we define or describe as well-being, right? So, whether you feel rewarded or not, whether you feel like the benefits are sufficient enough or generous enough for your needs, what you make of the workplace culture, right? Whether you feel like there's alignment between your personal values and the organization's values, all of that is total rewards. And we can sort of get into the specifics of different benefits types, but the point is the average employee does not compartmentalize total rewards versus benefits versus well-being. So I think the movement to ensure that well-being is well integrated into total reward strategy, but also benefit strategy and workforce strategy, I think aligns with the way that the typical employee sort of expects to be supported.
Wonderful. All right, last question. Maybe. I think it's the last question. We'll see. What advice would you give to a new head of benefits or total rewards who wants to do things differently? Of course, aside from, call Journey immediately, aside from that.
I was gonna go aside from call Avenue from Brown and Brown.
There you go. There you go.
All right. No, Stephen, what I would say is we are blessed with a wealth of resources on best practices, leading perspectives, what's working, what's not working. There's a ton of survey data out there from some really credible organizations, right, on leading and effective benefits and well-being trends and practices. There are a ton of conferences that you can attend, right, to hear from peers about what's working, what's not working, what have they tried before, what's failed. I think a significant part of our work, me, you, benefits leaders, is just sharing those insights and making sure that we soak in as much as we can, whether from a survey data perspective, whether it's listening to peers, whether it's going to these conferences. I think there's a lot that can be learned from some of those resources. And I also think that that's important. But the other thing I'll say is be willing to try something, right? I think oftentimes what I find with many leading organizations is they're more likely to give something a shot. Again, within reason. So pilots, be creative, be strategic. And the third and really important sort of other element that I'll mention there is have a really clear point of view around how you're going to measure, right, the effectiveness of some of these solutions. So it's connect with people, it's be willing to try creative ideas, but also have a clear idea around how you're going to measure success for all of the initiatives that you deploy to support global health and well-being.
Awesome. Awesome. All right. So just to wrap here. So, you know this, right? At Journey, we talk a lot about proactive mental health and the idea that the benefits are just the start, right? How can we shift the culture to create one that really supports folks? And that's why, it's great to hear people like you who have spent, decades really doing deep thinking about this. So I'm grateful for your insight, your clarity, your time, your commitment to this work. So thank you.
Thank you.
Um,
Thanks for having
any
me.
any final thoughts you want to leave folks with?
I would say it's an exciting time to be in the space that we're in. I think you see there's so many macro factors that we've talked about, right? Which is it's a competitive talent landscape. I think people, interestingly, yes, they value salary and compensation, but I think there's a growing perspective out there around the workforce that alignment between personal alignment between one's own personal values and the organization's values are important, and also their perception of how to be they want to be supported. All of that is really important. So it's exciting for me as a consultant to be a part of this and to work with leading organizations to and leading solutions, right? I would say like Journey to design and deploy some programs that really make a difference, right, in people's lives. I think Stephen, something that is really sobering for me, right, is I feel like there's purpose to my work as a consultant because everything that we do in this space, designing health and well-being programs, yes, we work directly with directors of benefits and CHROs and benefit managers, etc. But at the end of the day, we're doing this stuff for real people, right? Whenever I hear the stories of testimonials about, my son or my daughter used X, Y, and Z solution, and before that we couldn't find a provider, and now they're much better. You hear stories about, we couldn't have baby before, but we use X, Y, and Z solution, and now we've got our child. There's so many of those stories, right? And I think it's humbling and it's fulfilling to be in a space professionally where in our own little ways we can have an impact on people's lives.
I love that. I love that. Well, I think that's a great place to leave it. So, Abinue, thank you so much for your time today. I greatly, greatly appreciate it. Thanks for spending this time with us. We know you're busy. If you enjoyed today's conversation, be sure to subscribe to the Mental Health Advantage and leave a review. Thanks so much and have a beautiful day.